Hello, we're here today to talk about COVID-19 or Coronavirus Disease 2019. As you're probably aware from listening to the news and mass media, there's been an outbreak of this virus in China and also cases around the world. Just as a way of introduction, there's many viruses that cause respiratory illnesses in humans in different classes, coronavirus being one class of many. Coronavirus has been named because the outer spikes of the virus look like the corona of the sun, the outermost surface of the sun. There's four main subgroups of coronavirus: alpha, beta, gamma, and delta. Human coronaviruses were first identified in the 1960s. Common human coronaviruses are 229E, NL63, OC43, and HKUI strains. People around the world commonly get infected with these viruses. The four strains I mentioned above cause about 1/5 of all common colds known to man. Multiple other strains, however, cause disease in animals. Sometimes coronaviruses that infect animals can mutate and become a new human coronavirus. We've had 3 examples of that over the past 20 or 30 years. Originally, the SARS coronavirus, which is a coronavirus that causes severe acute respiratory syndrome. The MERS coronavirus, which causes Middle East respiratory syndrome. And now the new 2019 novel coronavirus, or COVID-19. Coronaviruses are zoonotic, and what that means is they are transmitted between animals and people. SARS was transmitted from civet cats to humans, MERS from dromedary camels to humans, and there are several other known coronaviruses circulating in animals that have not been yet infecting humans. This coronavirus outbreak started in Wuhan, China, in the Hubei province. As of February 14th of 2020, 60,364 people have been infected globally, the vast majority in mainland China. There have been 15 cases in the United States as of this date. Nearly all had a risk of recent travel to China. The authorities suspect more cases are present than are being reported. The likelihood of dying from COVID-19 is less than for SARS or MERS. How is this virus transmitted? Early on, many patients in the COVID-19 outbreak in Wuhan had some link to a large seafood and live animal market, suggesting animal-to-person spread. Later on, though, a growing number of patients did not have exposure to animal markets, indicating person-to-person spread. Chinese officials have indicated that person-to-person spread in the community is still occurring in China. And person-to-person spread has also been reported outside of China. In the United States, we've had, as of February 14th, we've had 15 positive cases, 347 negative cases, 81 pending cases, for a total of 443 cases. States with confirmed COVID-19 cases have been Washington State, California, Nevada, Texas, Wisconsin, Illinois, and Massachusetts. The case fatality rate is a bit questionable because, of course, the sicker patients are being identified first, and the less sick patients may go undiagnosed and heal on their own. Actually, of the confirmed cases in China, 18% were reported severe infection, and only 2% and 2% died, which is considered a lower case fatality rate than previously reported. More to come on that. Coronavirus jumped from animals to humans and they've been floating around in bats for a long time, and then come through an intermediate host where they may become genetically more diverse. It's felt to be, their spread is felt to be through from person to person via respiratory droplets among close contacts. It's unknown at this time whether there's fecal oral transmission or fomite or non-person to person fomite transmission. There have been case reports of asymptomatic transmission. Close contact is being within 6 feet of a patient with COVID-19 for a prolonged period of time. Symptoms include fever, cough, and shortness of breath. Vast majority of patients have mild illness, and symptoms may appear in as few as 2 days or as long as 14 after exposure. Those at greatest risk of infection are those who have had prolonged, unprotected, close contact with a patient with symptomatic confirmed COVID-19 infection, and those with recent travel to China, especially the Hubei province. Of course, sicker and elderly people are the most at risk. The organism has been isolated from upper and lower respiratory tract infection. It's not known yet whether or not people can be infected more than once, or in other words, whether there is an immune response, a protective immune response created. Healthcare personnel should protect themselves. Healthcare personnel and others treating patients with COVID-19 should protect themselves with standard precautions, contact precautions, airborne precautions, and eye protection. There are some experimental treatments underway. One is called remdesivir, which is an investigational drug that was used for Ebola. And then another HIV protease inhibitor named Kaletra is also being trialed. But there's nothing definite, no definite treatment at this point in time. CDC does have a novel coronavirus real-time reverse transcriptase PCR diagnostic test. Prevention is, as we mentioned, with gowns, gloves, face mask, avoid close contact, avoid touching your eyes, stay home if you're sick, and disinfect your environment. The CDC has issued a travel response for recommending that all travelers avoid non-essential travel to China, and and patients are quarantined if they come from China to the United States for 14 days. Thank you.